So one of the questions that I have for our panel is, what are some of the specific stresses that you're seeing in either yourself or the people around you? And I know many of you have surveyed your coworkers as to how they're affected by stress. And I'm wondering if you could just share some of the common themes that you've been made aware of.
Yeah, so like even like here at my site, like a lot of my staff and whatnot have talked about a sense of it, work being almost eerie. It's been quiet, and they're not really sure what's to come.
Yeah, I would build off of that. I think they're in this place where they know that they're in the calm before the storm, and they're worried about what's to come. And then we've started to take steps to plan for the worst. And so we're in meetings day after day after day, just talking about worst case scenario, which in itself can be quite hard on a person's psyche. But then you start to question, are we under-preparing? Are we over-preparing? Are we under-prepared or are we over-prepared? Like, have we gotten to a place where we're okay, where we're feeling all right? Or is that some sort of false sense of security? For some units, there's been massive disruption. So we've tried to abandon units to free them up for other units who we think might be hit hardest. And so in that disruption, we're asking our staff to lean in and to help with the logistics, with the strategy, with the planning, and then with trying to find some new set of normal again in their practice to be able to take care of patients. Amidst, again, like we were saying, this looming threat that we see every day in the media, on every email we get. We're inundated with information and trying to understand who is the source of truth today in this hour, because it seems to change so rapidly, and trying to keep on top of that is really hard too. And so I mean, we don't really get the chance to shut off from the information overload that's coming at us every single day. And I'm hearing that a lot in person conversations, but then also social media, I think, is really telling as well, because people then have a platform to be able to share their thoughts and their fears and where they're at in this moment.
Yeah, I totally agree with what Nicole just said about the information inundation. And I think maybe from an emerge perspective as well, we are definitely starting to see those patients, especially in Calgary. So I find that our staff are almost exhausted just because of being in PPE all day. Every patient that comes in, we're treating as COVID positive. We're having a whole new setup for how we're managing our critical patients that are no longer in our typical areas. We're running them in isolation rooms, which just sets us up for a different cognitive overload, because we're used to running and things just on the spur. We just do things naturally, and now we have to take our staff into a different area, running these situations that are critical with limited staff to decrease contamination risk in a different area. So supplies aren't where they should be. So we're really challenging people's cognitive overload in these critical situations. So I'm finding that that's kind of created a lot of the extra stress. And one thing, Jeff, I really liked that the kind of the anxiety thing. I'm used to being an emerge nurse. I'm used to working at this level, but I'm also used to being able to go home and having my decompression strategies. And I think over the course of 27 years, done a really good job at coping with my everyday stresses. But I'm finding staff, you can't go home anymore because the news on the way home is talking about how bad it's going to get. You're getting questioned about whether we're doing the right thing, whether we have enough PPE. We aren't able to see our loved ones. And then you have people that are getting sick that you can't even go and visit because of the visitor restrictions. So I don't think we're able to have an appropriate decompression when we come home, which I think is letting us go to work ever so slightly higher every single time. So yeah, that really hit home, and you showed me that graph. So
as our panel just discussed, that there are unique aspects of stress in our healthcare workers during a pandemic, things that we couldn't have anticipated, things that we couldn't have known about, but that we are left to address. One of the things that we're hearing quite often that can be an added stress is a stigma of healthcare workers being risked outside of the workplace to their own family, and that need for self-isolation. But where do they isolate? Where do they go home to? Do they find a place that further distances themselves. And then many of you identified as well, sort of that concern, not only for your own health, that what's different for a healthcare worker is that you're in a facility where you usually are dealing with other people's worst day. But I think that the virus, the risk of it affecting people that matter to you, but also yourself and your colleagues, adds in a different dimension of stress, that you are part of the community that is affected by the potential for infection, but also you are there providing the treatment for it, and that the virus doesn't know what role you're in. It treats everybody equal. I think that what is different and what we're hearing is that society doesn't necessarily do that. That society doesn't treat everybody equal, and that there is that stigma attached with what you do and the level of risk and the level of exposure, and that is putting a risk, a level of stress. Something that also came up, which is, as healthcare workers, you have a degree of knowledge that both helps you, but probably adds a level of stress as well. Within the workplace, you have that ability to control your own personal protection and to enforce rules. But oftentimes outside, we see family members, we see the public, we see people as we're grocery shopping or doing our normal routine, who really are putting themselves and maybe even themselves, ourselves, other people at risk by their choices. And that can be particularly hard with the knowledge that you have about the measures that could be taken, and when you see people that aren't either concerned for it or taking the measures, and knowing the potential risk and harm adds a level of stress. The other thing that we hear too is whether it is an actual or perceived worry about access to equipment, the right equipment, the number of respirators. When people show up at your sites, you are expected almost, it comes with the understanding that you will be able to do your job. And I think that what we're hearing is that not only does the media, but also organizationally, do you have the resources to do the job? Do you have enough face masks? Do you have enough respirators? Do you have the ability to change between patients, or do you need to conserve and reuse? And there seems to be a lot of mixed messages from media, organization, and we hear that people just don't know who to trust with the accurate information. What is really concerning is a lot of preparation for the treating of another coworker who's infected, or even the death of a coworker. We really call these line of duty injuries and line of duty death in other areas. It's something that we don't like talking about in the caring profession, but it is a real risk of, not only do we recognize that we serve the public, and not only do I realize that I could be potentially, hit with the virus, but that also my coworkers, people that I rely on, could also be impacted. They could also be at risk of death. People are drawn to healthcare because they have this want and need to do something. And really what we're hearing is the pandemic is a lot of preparation, but not necessarily being able to do anything to lower the risk right now. It's different in different communities, but it's waiting for that tidal surge to come in, that hearing that it might overwhelm the system, but being and feeling helpless and powerless to actually sort of lower that wave on your own. And the one thing that we know about public safety personnel and healthcare workers is that feeling of not being able to do anything adds a different element of stress than it might for the general population. And Nicole mentioned it in sort of what I think all three of you mentioned this, is that you guys are trained to prepare for the worst. But I think that you can't turn it off because you go home to it. You drive home with the news on, you get home to the news, you get the inundation between emails and information, both at work and on your personal machine or your personal email, your family, your friends asking all about information. And it's hard to turn off that anticipation. And what we know is that stress is caused by the unknown and predicting a negative outcome. So this anticipation of the worst is really worrying about the worst, which is directly related to increased levels of stress and anxiety. yet it's the world that you step into and out of every day, causing that stress reaction. What's unique to healthcare workers specifically is something that we call this moral dilemma. And it's really this conflict between knowing what patient care is and being able to provide it within the constraints of those things that are beyond your control. And we know that the most common influencers, and the research says that moral dilemma arises not from one factor, but when there are multiple factors. Everything from things related to the employer, regulatory bodies and the colleges that you, standards of practice that you operate under, family, patient demands, and also the smaller scale politics, but also the larger scale politics. We know everything from the difference between what might be happening in one part of our province to one part of the country to the different parts of the world. And we're inundated with this 24/7. And so this increases those risks of moral dilemma to those who are really at the front lines of these long duration, highly intense, unpredictable events. We also know that what increases moral dilemma, the risk for the inordinate stress, is when people are called upon to do things that they haven't trained for. And I think that, Leanne, you brought up that just the different way of navigating your normal workplace, the normal flow of patient care, but also your use of PPE, and that it sort of disrupted what the normal flow is. And it's hard to practice and to be able to do this succinctly until you're really in it. The other thing that we hear is that people are being called upon to use skills that they haven't used in years, as if they should be able to be up and running. And that leads to the fears of the decisions that people will have to make. I think that one of the things we've heard is simply who will get a piece of equipment and who will not, who will get a bed and who will not, who stays home and who comes to emerge. And the decisions that people are being called on to make can be really that difference between the perception of life and death. And then we also know that at the front lines, the risk of moral injury is directly related to this exposure to trauma. The usual traumas that you prepare for in your training, they become sort of abnormal traumas, such as some of the isolation, the limiting of visitors, and being with a patient who is having an adverse outcome, but who can't have the comfort and care of perhaps their family around because of these restrictions. That can add to that extra element of trauma that healthcare workers experience. And then we often are hearing right now about this balance, protecting yourself, your families versus the demand of doing the job. And we hear people conflicting about going to their job where there is that increased potential of coming in contact with the virus, perhaps even infection, and the concern about bringing it home because of their want and need to do the job. So these are some of the factors that are specific that we're hearing and that some of you have mentioned that are increasing the stress, this moral injury. So how do we cope with it? Well, I think first of all, identifying that moral injury and the risk and the factors exist, and that relating it to what's responsible for it, which are these multiple system failures rather than personal weaknesses or failures. That it is many of those factors that conspire against individuals in healthcare to increase this risk, rather than their personal weakness, their ineffectiveness, or something about their work, their ethics, their training. And what we actually know is that organizations that adequately upfront address the potential and or failures in the system prevent the cumulative effect on healthcare workers. When things aren't going right, is being able to pivot, to address it, to move, to acknowledge it. But many organizations and individuals can look at either blaming or scapegoating, abdicating their role, and that can perpetuate and increase the risk of moral injury and stress. any questions or comments about this section on moral injury?
I think, Jeff, one thing that comes up with us is having to change some of our critical practices, in the sense of when we have a cardiac arrest, we're used to jumping in, and now we're being asked to consider PPE, and we're, I think, dreading those days when decisions like that might have to be made. So yeah, I'm not sure how to prepare staff for that, other than we have to obviously figure out in the moment. So
Yeah, and I think that there's a difference between preparing for it and anticipating it. And I think that an organization that can prepare their staff for those challenges do far better than leaving their staff to anticipate it, feeling alone to meet the challenge in real time, than to know what supports are available to them prior to it happening.
And Jeff, I want to just touch on your portion about just like staff struggling with the dilemma of like having their kids at home or even their significant others, and just that increased stress of worrying about bringing it home or even getting sick. And I think it's just something that resonates with all of us.
Yeah. I think that even transmission between patients who might come for treatment, there's just that added level of vigilance that really doesn't know the limits between the work environment, the home environment, the community environment, just living as if everybody is infected and you have the potential of infecting everybody. Just, again, that unrelenting stress does have an impact.
Jeff, you talked about the sort of the overarching contributors out in the community sometimes, and I know that the political tone of the province has been affected over the last months, and we're seeing a different sort of rhetoric now that we're in the pandemic, but there's this worry, especially toward nurses, that that after the pandemic's over, what does that mean for me and my profession, especially considering, you know, what we're seeing. I don't want to get too political, but what we're seeing with the physician group over the last week. And so I think that's sort of contributing to this moral injury, is like, where do I stand? Am I important or am I not important? Am I sacrificing myself for my province and my patients who I care so much about, or should I not because I'm not valued? That's really tough.
Yeah, and I think it comes down to definition of worth. And I think what you're saying is that different levels of within the political realm seem to assign different levels of worth to the same people depending on the circumstances, which can be really, really confusing. And it can be a perfect storm when there were stressors that occurred prior to the pandemic that haven't gone away during the pandemic, and that continue to sort of be an undercurrent that that sort of this wave is now coming across and riding on top of. And you're right, that is another true sense of what's causing a lot more stress in our healthcare workers. Yeah.